Hello everyone, this is Dr. Manojit, a pediatric dentist. Today I am here to discuss about the importance of treating the milk tooth. So the milk tooth has basically two to three important functions. The first and the major one is it helps in chewing food for the baby. The second is it helps in maintaining the space for the permanent tooth to erupt. So we have to consider these functions as the child grows. So we have to keep these teeth intact. So if there is a cavity in the milk tooth, it is very important to treat it. The reason behind it is if there is a cavity, the cavity means it is a source of infection. And once there is an infection in a tooth, it can and it ultimately will affect the permanent tooth. So for the well-being of the permanent tooth, it is very important to treat the cavity in its initial stage. Also, if there is a cavity, that means the source of bacteria is there in the mouth. So even if when the permanent tooth erupts, which is very good in the initial stages, it can get affected due to the presence of bacteria in the mouth. Secondly, if the permanent tooth has to erupt in its correct position, the milk tooth has to stay in its designated spot for the correct time period. If there is a cavity or an infection, that might lead to the loss of the primary tooth before its time of exfoliation. So for this time, we have to maintain the milk tooth in its position. Otherwise, the permanent tooth will come in a different position in a crooked manner, and that will lead to ultimately a lot of orthodontic treatment to get a proper alignment of